So this is a general difference between these two cases, preductal and postductal. Preductal, the classical point to note is the cyanosis that is typically present in the lower extremity. The upper extremity may be normal. So this entire issue is a entire column is for the infantile type of coarctation of the aorta. You get a cyanosis in the lower extremity, hypertension in the upper extremity, weak pulse and pulse pressure both can be seen in the lower extremity. If you look at these features like hypertension in the upper extremity, weak pulse in the lower extremity, we also get something like that, but not exactly this, exactly reverse, which means there is a hypotension in the upper extremity and there could be hypertension in the lower extremity. So in which disease you can recall where you get exactly reverse what we see in the coarctation of the aorta. I want to give you a clue. It is a kind of vasculitis where we can see this kind of feature. What is that? Anybody in the class? In the postductal, if you look at this area now, you do not see a cyanosis in the lower extremity, and this is an important difference between these two cases. Another important clinical feature of the adult type of coarctation is that since the lower extremity is getting less amount of blood, patient will experience claudication. It is simply because of the hypoperfusion of the blood in the lower extremity. So you don't expect the infant who has a pain in the lower extremity to complain to you. That is why I am not discussing that a claudication is a clinical feature of the preductal type, because even if they have a pain in the lower extremity, if it is infant in the first 3 weeks of life, you don't expect a claudication as a clinical feature. But claudication is definitely a clinical feature for a postductal coarctation which is present in the adult life. I hope that you understand it. Even if the kid has a problem, he or she will never complain. So we cannot say claudication is present there. But definitely there has to be hypoxia. He or she definitely should have a pain. But claudication is a word typically you should use for an adult patient. Now this is another interesting point about the adult type of coarctation of the aorta. In fact, this kind of feature also can be seen in the infantile type. What is happening here? Since the upper extremity is getting huge amount of blood, more than normal, most of the blood vessels in the upper extremity will be dilated. Now it is interesting to note that there would be a partial dilatation of the ascending aorta as well. So in most of the patients with the coarctation of the aorta, you can see that the aorta, before that coarctation has taken place, so before the area of the coarctation you can see some aortic dilatation. In short, we can see the aortic dilatation of the ascending aorta in most of the patients with the coarctation of the aorta before the areas of obstruction or proximal to the obstruction. So that is one point, dilatation of the aorta proximal to the obstruction. And since many blood vessels will be dilated because of this extra amount of blood, which is basically arteries, which we classically call opening up of the collateral vessels or dilatation of the collateral vessels. Many collateral vessels like internal mammary artery or intercostal arteries, they run very close to the ribs, which is a bone. So as a result of this thing, these dilated blood vessels will slowly erode the bones. And if you look at this picture now, is the X-ray picture of a patient who has a adult type of coarctation of the aorta. Now you can see these ribs, particularly these two ribs on the tip of the red arrow, they are a little bit of notched or eroded. Now this is known as rib notching, and this rib notching is a classical finding in a postductal type of coarctation of the aorta. So once again let me summarize it. Since the blood vessels of the upper extremity is getting more blood, so these blood vessels, typically the arteries, will be dilated and tortuous. Because of this dilatation and tortuosity, if this blood vessel is close to a bone, you can get erosion of the bone, which can be seen on the X-ray, which is known as rib notching. That is one point. And because of the narrowing of the aorta which is proximal to the narrowing should be dilated. So if we take X-ray of the chest, we can see that a dilated aorta proximal to a narrowing. So these are the two important radiological findings we should try to remember as an important diagnostic aid for the postductal coarctation of the aorta. Okay, remember this point. And this is all about your coarctation of the aorta. So coarctation, finally, two types: infantile type, in which case you get a patent ductus arteriosus, and adult type, in which case you do not get a patent ductus arteriosus, and this will make a huge difference in the clinical feature of this condition. Thank you so much. If you have any problem or any questions or concern, please give me a call 321-6222, or you also can email me. Thank you.